Well, they know that.
Yeah.
My last, Tuesday, I couldn't get into one of the doors here. It was like a bunch of my freak, this freak.
Not that I ever.
They don't want to hear something like
Yes. Not that I never actually go into the classroom, but like, it feels purposeful. They don't want to. What do you do?
You gotta ask for permission.
Oh, thanks. Well, actually, no, we only got 4 or 5 hours.
You just said cover if needed, otherwise.
Well, we're working on this. Yes, comes out in the budget. Yeah. She took her off.
Do you know how we're doing for quorum, Terry?
Let's see. I think we are pretty close to 1, 2, 3, 1, 2, 3. Yep, we have a quorum. And it is 10 o'clock, co-chairs.
Cool. All right. Well, I want to welcome everyone to the June MLAC meeting. And as always, start off with the affirmation to get ourselves in the proper headspace here. We would like to thank everyone for their time, effort, and participation in our work for us today. We want to recognize it as very difficult and important work, and we appreciate and value the perspectives and professionalism that everyone brings here today. Thank you. Starting off with roll call.
Sarah Merrick.
Morning.
Co-chair Strickland.
Present by video.
Margaret Woodall.
I'm here.
Lauren Bowling is here. I see him. Okay. Sarah Duckwall.
I'm here.
Good morning. Ryan Hearn.
Present.
There he is. Okay. Stacy Llewellyn is not here today. Co-chair Priest.
Present.
And Kim Schlesinger.
Present.
Okay. And I understand Director Stolfe is on his way back from the Capitol. All right. We have a quorum.
Great. So starting off, I see a spot for public comment. My understanding is that there's someone in person interested in making public comment.
Yes. Dr. Stabo is here,
Where do you want me?
if you wouldn't mind. Thank you.
Good morning, Chair Strickland, members of the committee. For the record, Dr. Vern Sable, representing the Oregon Chiropractic Association. I just wanted to make some brief comments about yesterday's subcommittee on access to care, and specifically, Safe Corporation again mentioned the reality of medical costs going up. I think the last one was 2024, and I wrote that correctly, but I think it was 11.4% increase during that year. And so I wanted to have the committee hear a substantial study that I was unaware of until just last week during our national or federal, I'm a member of the American Chiropractic Association's legislative committee, and my colleague and chairperson from Missouri brought this to light. And it's a 2021 cost study by the Workers' Compensation Research Institute looking at chiropractic care. They studied some 2 million claims spread across 28 states. In those, there was a 61% lower cost when injured workers treated exclusively exclusively with a chiropractic physician, and specifically the average claim cost was $1,366 versus $3,522 when there was no chiropractic management. And when it came to worker time loss payments, the average was $492 with exclusive chiropractic treatment or management versus $3,604 with no chiropractic treatment. And then lastly, there were fewer drugs prescribed. There was 1% of the chiropractic managed cases ended up getting opioids, whereas 10.3% were prescribed opioids with no chiropractic care. And then when it came to special imaging, specifically MRI, 4.3% of the injured workers received an MRI versus 18.9% of the folks that did not have chiropractic management. I don't know if this is not a chiropractic vendor or someone who has a bent towards chiropractic. This is an independent agency, vendor. And I'd just like to read briefly what their mission history is so you get an idea of who these people are. Our mission to be a catalyst for significant improvements in workers' compensation systems, providing the public with objective, credible, high-quality research on important public policy issues. The Institute was founded in 1983. The Workers' Compensation Research Institute is an independent, not-for-profit research organization which strives to help those interested in making improvements to the workers' compensation system by providing high-quality, highly regarded objective data and analysis. The Institute does not take positions on the issues it researches. Rather, it provides information obtained through studies and data collection efforts which conform to recognized scientific methods. Objectivity is further ensured through rigorous, unbiased peer review procedures. The Institute's work includes original research studies of major issues confronting workers' compensation systems, for example, outcomes for injured workers, prescription drugs and opioids, physicians dispensing, studies on individual state systems where policymakers have shown an interest in change and where there is an unmet need for objective information, studies of states that have undergone major legislative changes to measure the impact of those reforms and draw possible lessons for other states. And then finally, presentations on research findings to legislators, workers' compensation administrators, industry groups, and stakeholders. But just so you understand who this group is if you weren't aware of it. I appreciate your time.
Great. Thank you for that information. Any other public comment?
Not in the room, Coach Strickland.
And I'm not seeing any hands or any people leaping off mute online. So give it just one more second. All right. So next up, I see a review of the May 1st minutes.
I move approval.
Okay, we have a motion for approval
I'll second that motion.
and a second. Any discussion? I guess the only discussion that I have is I will be abstaining as I was absent. So any other discussion?
I will also be abstaining because I was absent.
All right. All those in favor of approving the minutes signify by saying aye.
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 Any opposed? Any abstaining?
Aye.
All right. Next up, I see department updates, starting with a workers' compensation case law update with Lauren Eldridge, who I see taking herself off mute.
Thank you, Co-Chair Strickland. Thank you, co-chairs and members, for having me today. I do have a quick update today on two cases involving permanent disability benefits. The cases are Eugene Walters and Stephen G. Hall. They are both summarized in the previous quarterly report. So these cases are interesting because they apply the Oregon Supreme Court's decisions in Karen, Johnson, and Robinette. As a refresher for anyone who might not be familiar with those cases hold that unless a carrier accepts and then denies a combined condition, the carrier cannot apportion a worker's permanent impairment, even if some portion of the impairment is related to a pre-existing or denied condition. So the bright line rule to take out of those cases is that in the absence of a combined condition acceptance and denial, a worker is entitled to the full measure of impairment for a particular impairment finding if the finding is due in material part to the accepted condition or its medical sequela. So in the Hall and Walters cases, the physicians whose opinions were used to rate the worker's permanent impairment concluded that a particular impairment finding was 10% attributable to the accepted condition and 90% attributable to a pre-existing or denied condition. In both of those cases, the carrier had not accepted and denied a combined condition. So the issue before the board was whether the impairment findings were due in material part to the accepted conditions. In both cases, the majority opinions of the board said yes. So the majority opinions concluded that the medical opinions attributing 10% of the particular impairment findings to the accepted conditions were sufficient to establish that the impairment findings were due in material part to the accepted conditions. In both cases, one member dissented. In the Hall case, member Curry dissented, and in the Walters case, member Ogawa dissented. The dissenting members focused on the meaning of material cause in the compensability context, which has been defined by the courts as a substantial cause, but not necessarily the sole or even the most significant cause. Based on that standard, the dissenting members reasoned that the material standard requires more than a minimal cause. Finding 10% to be minimal rather than substantial, the dissenting members concluded that the impairment findings were not due in material part to the accepted conditions. Member Curry further noted that in her opinion, allowing a carrier to apportion permanent impairment where some of the impairment is due to a pre-existing or denied condition provides more fairness and predictability regarding permanent impairment awards. So under the current standard, she explained that some workers who do not meet the materiality threshold will receive no impairment, even though a small portion of their impairment may be attributable to an accepted condition. In contrast, she explained that some workers will receive substantially more impairment than that actually attributable to the accepted condition because they meet the materiality standard. Member Curry ultimately suggested that the court either reconsider its decisions in Karen, Johnson, and Robinette, or that the legislature take action to implement a system of apportionment for permanent disability benefits. That is all that I have. Are there any questions?
Not seeing any. Thank you
Thank
for
you.
the report. I can hear the whisperings of my torts class professor about eggshell plaintiff rule and its application to work comp. So that's a bit of a throwback.
Yeah, thank you.
Appreciate that. Thank you. So next up, I see Workers' Compensation Division updates with Terry Watson.
Okay, I'm going to kind of triage back and forth. So the first update is the follow-up from the Worker Benefit Fund presentation from Kelly Bushka. Scott, we held that over, or co-chair, we held that over because you had asked for that document. And so everybody had a chance to review that. And Kelly is available for questions if there are any questions. And she is online. So members, are there any questions about the follow-up from the Worker Benefit Fund presentation?
I just want to thank Kelly and the team for that work. I think it's very helpful because I know especially in context of, wage discussions and other things, it's helpful to know how that indexes to inflation. So are you seeing a trend that is sort of abnormal or spiking in a certain field, or is it more kind of keeping track with general inflation economy wide? And I think that data was helpful, and the updated analysis or the additional analysis was helpful in understanding sort of what the data as presented is really saying. So I really appreciate that and that work. Sarah, I see a hand.
Thank you, Co-Chair Strickland. This is not pertaining to the report, but just in fact the Workers' Benefit Fund in general and the status of the potential transfer of funds, the swapped funds. If we could get any information update on that, that would be helpful.
Co-Chair Director Stolfi is in the room if you have any questions.
Yeah, good morning, everyone. Andrew here. Scott, thanks for the eggshell plaintiff throwback and the memories of that. But so yes, I was going to give an update on that as well. So the DCBS budget bill made it out of the Ways and Means Transportation and Economic Development Subcommittee yesterday. I haven't seen if it's scheduled for the full Ways and Means on Friday, if not this Friday, next Friday. That bill, our budget bill, does not include a specific WBF transfer to BOLI, which is not surprising. There are multiple ways for it to happen, and I was at least kind of expecting it to be in a different bill. So we are still expecting there to be a transfer from the WBF for BOLI. As a reminder, the governor included in her recommended budget a $15 million transfer from the WBF to support BOLI. Lots of discussions going on around what that would look like. The latest I heard is that perhaps it could be something much less than $15 million, that $15 million might not be needed, but that will be part of broader discussions that we're not necessarily always directly involved in. We have looked at it during the budget development process, and we testified and have spoken to this. A $15 million transfer from the WBF would not impact the fund or the rate setting in any way. It's absorbable, so to speak. And that's kind of where things are now. Teresa and I were just talking, and I've messaged our budget people, but we spoke about this yesterday with them and haven't heard anything more specific other than we're expecting that transfer to be in another budget bill that deals with BOLI. Maybe one last thing I'll say is BOLI's budget is in the same Ways and Means subcommittee as ours. They said at the end of the hearing yesterday that we were in that there was a chance their budget bill could be heard today, and that committee meets at 3 or 4 o'clock at the end of the day. Their sine die has been deemed imminent, meaning they only have to give a 1-hour posting for agendas and other stuff. So, I mean, we could find out at 2 o'clock or 3 o'clock today that the BOLI budget could be up today, or it could be next week, kind of whenever they're ready for that. So hope that helps. Don't have a real definitive answer because we don't know exactly how much or exactly where it'll be, but are expecting it at some point.
Thank you, Director Stolfi. That does help. May I ask, or may I follow up, Co-Chair Strickland?
Sure.
Okay. If at some point it would be nice to know or have a presentation on the purpose of those swap funds brought before MLAC, if that could be arranged for a future meeting.
Aside from the presentation that we've already had, are you requesting an additional one?
I'm requesting to know exactly what those the swept funds, if they occur, what they're going to be used for. I don't believe we know what they're going to be used for.
It was my understanding that that was already presented on, I think, back in the March meeting.
Can you help remind me what they're going to be used for, Co-Chair Strickland?
I can help you.
Go ahead, Director Stolfi.
Yeah, so again, as far as we understood, and at the time, it was for general, like operational administrative expenses to support the workload. I think Boley had talked about this here. If not, they've talked about it a lot at the legislature, and there's some presentations from their budget presentation and others, which talked about their overall budget issues and workload issues, and the different solutions that they're seeking for that. This WBF funding would be a one-time help for that workload issue. So it would go to support some of the individuals. I'm not sure if it's a civil right. I'm not sure if it's been targeted to a specific division within Boley. I don't know if they don't necessarily do that, but it would go towards Boley's overall budget. And we often have someone from Boley attending the meetings. I don't know if they're here, want to speak more to it.
Thank you.
Thank you, Director Stolfi. I see Patrick has a hand up.
Yeah, thank you, Scott. I appreciated the follow-up. I also had the question about the budget, so I was kind of, happy that we had an occasion to ask about it again in the sweep. In the follow-up information, it does show some increases in payments above CPI. I trust that Director Stolfi says that the balance is sufficient, but there is an increase here. I don't know what dollar amount that is. And then also, I know we have a couple of subcommittees that are meeting to talk about some workers' compensation system issues that, I don't know, may require funding of some type into the system. And I don't know, I wanted to comment maybe that I feel like the Worker Benefit Fund has uses for workers' compensation. And so I also find it, something that MLAC, our role is to be protective of the workers' compensation system. And, nothing against the work of Boley. I'm sure they do very fine work. But I feel like our role is to protect the Worker Benefit Fund and would like to maintain those funds within the system for those uses.
Thank you for the comment, Patrick. I thank everyone for their interest and engagement on this. I feel like, before I kind of make a comment, are there any other questions relating to Kelly Barushko's specific follow-up and information? I want to
Maybe
make sure
just
she's not.
a dollar impact of what this increase is, that how it would affect the balance going forward. I mean, that would be nice to know, since we're taking funds out and we see an increase above CPI. So that would be nice to know.
So Patrick, are you talking about, again, relating to the budget issue?
Yes, there's the presentation, as I understand it, is reserve reimbursements, and that's a charge against the Worker Benefit Fund, if I'm understanding that correctly, and that those are that you're showing a chart with a trend. The trend line is above CPI, so an increase. So I was just curious if there could be other than a percentage impact, a dollar impact as it affects the Worker Benefit Fund, and if there's anything that we should be allowing for the future above current estimates.
Well, and again, I'll defer to Director Stolfi on this, but again, it's my understanding that was included all in the discussion previously at the previous meeting, with the explanation of the trend line and the historical contribution rates and the way in which those contributions increased and decreased.
We just put it up on the screen, co-chairs.
And Kelly's on. I don't know if it would help for
Yeah.
Kelly to just give a little more about what this means to help everyone out.
Yeah, absolutely. So this is purely looking at historical information. So it's looking at previous payments for beneficiaries from the retroactive reserve. The retroactive reserve payments are based on the average weekly wage, which did fluctuate quite significantly because of 2020 with COVID. These payments are also slightly lagged because the payments aren't issued or reimbursed until about a year later. So there's basically what the COVID pandemic did was decrease the amount of claimants as people were not working, but then the average weekly wage spiked because low wage workers were not working. And as people came back into work, the average wage decreased a little bit. So my projection, and I can provide some additional information if it would be helpful, but that the kind of that spike that you see in 2022 is kind of an artificially high point where things will start leveling off as we get back to normal. A lot of economic trends have 2020 being a giant dip low and then kind of a big spike, like a square root function type thing where it goes very sharply down, spikes back up, and then kind of comes back down to normal. So that's what we're expecting to see here. But this information doesn't have anything to do with the budget. We do have projections for what we expect to have happen with the worker benefit fund, with all of the BOLI requests that are available. And as Director Stolfi mentioned, we do have cushion where it's absorbable for what BOLI has asked for.
Thank you, Kelly.
Yeah.
I believe it was the March 6th meeting where we covered all of this, including these projections, and that all of that information was included, including the possibility of an partial allocation to BOLI. And that that was kind of a budgetary matter, and that this is not related to any statutory changes. Sarah?
Thank you, Co-Chair Strickland. I would just request that on future requests for funds to be transferred out that are considered outside of the statute to MLAC be able to be part of the discussion.
Understood. I don't know that this is outside of the statute or outside of anybody's authority. I know that I've maintained that MLAC is not really a Ways and Means committee, nor do we have the either authority or ability to engage in that. I think if there is a statutory change or something that we're directed to examine, I feel that that's appropriate in my reading of the statute. I think any time that there are allocations and things that affect the fund, that is included in our report that we receive on the worker benefit fund, which was included in the March 6th presentation. And we had discussion over that and have been repeatedly kind of kept in the loop on that. So I don't know that I would say that this is news in any sense, but I do see a hand from Ryan as well.
You co-chaired Strickland. Just more of a general question. I mean, I think being MLAC, we have a responsibility to protect, or at least protect the system and watch the Workers Benefit Fund and in conjunction with that. Would it be an appetite of MLAC to maybe design some rules around taking funds from the Worker Benefit Fund? I don't know. Just kind of throwing it out there.
I think that's certainly something that we can discuss. I don't know that we're not a formal rulemaking committee. We don't have any rules before us. I think we could have some discussions about that, sure, moving forward, and especially the impacts of this. But I mean, we have an economist and the director of DCBS assuring us that there's not an issue here, which is the same information that was presented to us back on March 6th. So I think if there's, ongoing discussion, I know we have, annual updates on the Worker Benefit Fund, and that's definitely an appropriate time to kind of have these ongoing discussions with all of that.
Yeah.
But yeah, I don't see a need immediately now. And again, I don't think that we have the statutory authority to do that without kind of having a bill before us or having something directed to us. So, I mean, happy to have ongoing discussions about that, but we've heard confirmed twice now from folks that this would not have an impact, which is the same message that was delivered 3 months ago, almost to the day. So I, feel confident. Again, have confidence in the Ways and Means process and that we're not formally a part of that. Obviously, if there's statutory changes or something else that is directed for an opinion from us, that's a different story. But yeah.
I think for me, the main issue that I have is not so much the money that's being taken out, the 15 million. It's just what the worker benefit fund was designed for, and the fact that it's being pulled away essentially to fund other things outside of what the workers benefit fund was for. That's really where my worrisome is. Not so much the money that's going out, just the principles of everything.
No, and I understand and appreciate your concern. I would say that it's my understanding that the worker benefit fund statutorily is permitted to reimburse BOLI for costs related to civil rights investigations, among other things. And then that additionally, the governor has the authority to, recommend a budget and that budget bills can go through and do things as well. So that, would be kind of my offhand remark, but that plus the fact that we've been reassured that there would be no impact, I feel confident moving forward, but appreciate your concern and your passion about this as well. I see a hand from Margaret as well.
Right. Scott, I agree with you that I appreciate the passion and also the interest that Sarah and Ryan Patrick have with regard to the worker benefit funds. I would ask of them if they, next time this comes up, if they could review 656, 790. And, statutes are open to interpretation always. And if they could point to where in the statute we have the authority to do this, I would be, much more inclined to, be more interested in looking at it more closely. But as it is now, I think that we've been thoroughly briefed by the department.
Thank you, Margaret. Not seeing anything else. I want to thank Director Stolfi and Kelly Barushko coming in. Director Stolfi coming in hot after another meeting, just like it's my understanding happened last time. So, I see next on the list an MLAC calendar website update.
Yes. Megan, are you ready? Okay. So after the last meeting, we looked at, just a second. Comms put together a draft calendar after you gave me feedback. So I wanted you to take a look at this and tell me if this is more along the lines of what you were thinking. And this isn't live, but this is a different calendar with the different events that we have. So can you scroll down, Megan? So this has the different events the different annual events that we have. I think it was Sarah, you had this idea about, is this more along the lines of what you were looking for?
Can we keep scrolling? Is that possible?
Can you keep scrolling? So these are the different events that we have annually. And then at the bottom of it, it has upcoming events.
So yeah, I think that is definitely more in line with what I was envisioning, something that just placeholders for different months throughout the year.
Okay. So if this is what you're thinking about, then we can have comms make this live and then it'll be on the MLAC website. Okay. And others, is this what you were thinking, members?
I think that's helpful. The one thing that I might recommend, I see that sometimes it'll say, quarterly report. like the Workers' Compensation Board quarterly report, if we could do parentheses or something after some of them to just signify clearly, you know, this is annual, this is quarterly, this is whatever else. I know it kind of already says that, but in terms of folks skimming through quickly in the joys of the end of session, it might be helpful for folks to track more easily.
You know what, you're absolutely right, because it's hard to pay attention to anything right now with the end of session. Okay. All right, we will, I will talk to comms about publishing that calendar, and we will get all our events on there. Speaking of events. Okay.
Good morning. Good morning, co-chairs, members of MLAC. For the record, Matt West, Administrator of the Workers' Comp Division. So here to give the next two department updates. First, related to MLAC's interest in kind of holding off-site meetings around the state. Terry and I were able to meet with our partners in OSHA and discussed some of their upcoming conferences. In each of their conferences, they work with a local committee. And so they were able to talk to the folks in Bend about having MLAC join the conference, the Central Oregon Safety and Health Conference. September 15th and 16th is the conference. And the plan would be, so day one of the conference is Monday the 15th. It ends like 3 or 4, and then we would do like right after the conference ends or a little bit in the evening. We haven't figured out the exact time. We would plan the MLAC meeting and for that time, and they're going to allow us to have a booth during the day. So Terry and I could be there kind of talking to attendees, encouraging them to attend the meeting that afternoon or that evening. So it's at the River House in Bend. We're still working on some of the details, but just wanted to give that update and see if there's any questions related to that.
Yeah, I'm going to fill in a little bit more. So that would take place of our September meeting. So instead of having it the first Thursday in September, we'd have it on September 15th. So I have a couple questions. Our next in-person meeting would be in August. Shall we move that to virtual and then have our September 15th meeting be in person? I have lots of questions. So what do members think about that?
Sarah?
Thank you, Co-Chair Strickland. I love the idea, except I just want to flag I am not available on the 15th. Sorry.
Oh, shoot.
Yeah, so you want to talk about access to care? It's an appointment for my father that is months and months and months in the waiting. So.
Oh.
But it does not mean that the committee can't move forth. My absence will have to be noted on that day. But I love the concept and idea, so thank you for that.
Thank you, Sarah. Anyone else? Kim?
Yes, hi, thanks, Co-Chair Strickland. So Terry, just to be clear, so the 15th is on a Monday, September 15th. So we would attend the conference and then be present for a meeting. So we'd be part, no?
No, you don't need to attend the conference. Just come for the meeting, and then we'll have a social time afterwards so we can visit with conference participants. And I will be inviting elected officials like we did at the last meeting in the Dalles.
Okay.
So social time afterwards. So.
Got it. Okay. And then there's a meeting. Why do I have on my calendar an MLAC meeting on the 12th of September? Is that?
That's our access to care.
Oh, that's our access. Thank you. Okay, thank you.
So just recapping, it sounds like we would have the meeting that Monday afternoon and then have an opportunity for sort of a meet and greet afterwards, and then discussion of moving the August meeting to virtual.
Yes.
I don't have an issue with any of that. and I think it sounds great. I know we had a pretty good turnout and participation in the Dalles meeting that we did.
And I was just going to mention, you know, we can work with you on kind of what the format of the meeting's like. I know you didn't want to just go have like this meeting and have people listening. If you want to do more of a town hall type format for some interaction from those in attendance, we can kind of start thinking about ideas on how to make it a little bit different than people just showing up and watching the meeting.
We could do a co-chair dunk tank, maybe.
There we go.
Yeah.
Also, in the conversations with Charlene, OSHA conference coordinator, if this goes well, we could also maybe have one next June at the Pendleton conference, depending on how this all works out. So Sarah, maybe we'll get you in June in Pendleton. So at Blue Mountain, right? Is that what it is? Blue Mountain.
I believe so.
So we'll see how this goes.
Okay, and I do, joking aside, only because I've been volunteered for dunk tanks the last 3 Labor Day picnics. Joking aside, I do appreciate and think that the town hall setting would be a good way to go. So thank you, Administrator West, for that recommendation. I see Co-Chair Priest has a hand.
Yeah, thank you for that. I also want to just say that I really like the idea of going to this conference and having it in person. I think it's a great idea. I was going to ask about the August 7th meeting. I know there had been some talk about potentially rescheduling that meeting, and I don't know if this is a good time to mention that.
Co-Chair Priest, I just sent you and Co-Chair Strickland the interim legislative calendar this morning with some dates on it. Maybe you didn't get a chance to review it. So we may not need to do that, but we'll have more conversations about that. That just came into my inbox late yesterday, early this morning. So anyway, if you could take a chance to review that, and then we can email back and forth and have more conversation about that. And I'll get it out to the subcommittee co-chairs as well. So you have planning for that as well.
Thank you. And Patrick, that was going to be my next question, if there had been any other additional discussion on that. So good job. And just for everyone, stakeholders involved as well, I know that there was discussion of trying to get the subcommittees to have a report back by September. So there was a talk of potentially moving the August MLAC meeting to the end of August, since we were not going to take those reports likely at the September meeting. So there's discussion on that. I think we'll review the calendar and can have some further discussion, co-chairs and committee members and others.
Okay.
Thank you for that, Terry. I have not had a chance to review that yet as well. Yes.
So, thank you.
You ready for the next item? Okay, yeah, and I'm up for the next item also. So one of the, to Sarah's point in the calendar and the different things that come to MLAC, one of the things that we do each year, we're required to report to MLAC all denials and terminations of come-along providers. For a little bit of background, when a worker is enrolled in a managed care organization, they can bring their own provider to the MCO if certain conditions are met. There was a bill that passed in 2013 that made some changes and then requires us to report all the denials to MLAC. And so you should have a copy. It's up on the screen. So in 2024, there were 3 MCOs operating in Oregon: Kaiser, Permanente, Majoris, and Providence. They each provided the information to us, and there was one primary care physician in the Portland area that was denied. One worker was affected, and the termination was due to the physician failing to comply with the MCO terms and conditions after being granted the come along provision. So just the one in 2024.
And do we know that was one of how many that applied and utilized the program?
We don't have that data. They're only required to report to us the denials. So we don't have a report on the number of come-alongs that are granted.
Okay, thank you. Any questions from folks about that? I know Emily's not on, and Kim's probably excited to dive into that with the access to care subcommittee. But Patrick, I see a hand.
I do. I'm going to go back to, I'm sorry, the worker comp benefit fund discussion. And in the interim, I did take occasion. I really respect Margaret and her knowledge of the law. And she referred to a section of the law. And so I looked it up, and I just thought it was fine. I kind of felt that section, at least if I got it right, 656.790, as I read it, it seems as though MLAC does have a role in the balance of the worker comp benefit fund. And if you don't mind, I'll just read it out loud. And if there were any thoughts on it, I read it to mean that we do have input into it. So it says the committee shall advise the director regarding any proposed changes in the operation of programs funded by the Worker Benefit Fund, and shall review any plan the Department of Consumer and Business Services devises to increase the balance of the fund to meet the requirements set forth in ORS 656.506, assessments for programs. So to me, I don't know, it seems that we do have the ability to provide advisement on the Worker Benefit Fund in its balance. It's my opinion. So
I would say that does not include the ability and authority to advise on the governor's budget as it relates to use of that money. I think if there's changes to specific programs or an increase in funding and the plan to increase that funding, that is all there. But again, we've been assured now at least 4 times, I think twice in March and then twice again in this meeting, that even a $15 million allocation would not have any impact on the fund.
And co-chairs, I can maybe add a little bit to that. And it might be worth having a more kind of geeky legal conversation offline with the co-chairs to start with, and then we can come back. But and I was trying to pull it up. I don't have the statute in front of me, but I have looked at it a million times, and I think the key is how it talks about MLAC's role in regards to programs that are funded by the WBF. So if the legislature wanted to create a new program or to create a new, perhaps permanent funding source for any other entity that statutorily would come out of BOLI, it'd be hard to argue that that would not be within MLAC's remit to discuss. But what's going on with the transfer is different from that. So it's a legislative action that they just have the general authority to do to kind of take money from anywhere that they want and move it anywhere else that they want. So it's not necessarily a program funded by anything. It's a legislative transfer of funds. And that I think is kind of the big distinction. But as I said, would be more than happy in the interim to kind of dig into that legal aspect to it and talk to start with the co-chairs, and then if the co-chairs want to come back to the committee, we could do that.
I think that's a great idea, and I think that jives with my understanding and interpretation of it also in the discussion in the MLAC kind of 2.0 handbook that we generated, that if there was a new program, say OSHA started a new program for support for injured workers, and it would be permanently allocated from the Worker Benefit Fund, and that would require a 10-cent an hour increase in the assessment, that is something that could be covered. But a single one-time budgetary allocation of funds is not something that is considered within the purview, even under that statute. But I thank Patrick for bringing that up. I think it's good to reflect on these issues repeatedly.
Thank you for that, Co-Chair and Director Stolfi. So I'll say again, you'll be missed when you move on to your other committee. Maybe you'll come just because it's fun to our meeting.
Yeah, it's great.
Maybe we could put in a placeholder for updates from Director Stolfi. Updates from former Director Emeritus Stolfi or something like that. Thank you. Any other questions relating to the come along provider report? Not seeing any. Thank you, Administrator West. Next up, I see MLAC subcommittee updates, access to care first, which I see Kim.
Thank you, Co-Chair Strickland. I'll just give a brief summary or update of the Access to Care Subcommittee that I co-chair with Emily Rivas, who's not here today. All of the documents and agendas and meeting minutes are posted on the website, so I do encourage people to go and review that. They're all there, nicely organized. I think what I'd just like to share is a scope and objectives have been drafted, and we're going to look at that at each meeting and tweak it as needed. But I think just going over the objective would give everyone an idea of what we're trying to accomplish, and that is to identify key barriers to accessing timely and appropriate care in Oregon's workers' compensation system, and to develop evidence-based, stakeholder-informed recommendations that support provider participation, reduce administrative burdens, and improve outcomes for injured workers. So that's the task that we're trying to do. The first couple of meetings, it's really just exploratory. We're just looking at reports. We've had some great presentations yesterday of some research and data that's already been done, so that we can get our hands around this enormous problem. I think also our goal is to identify short-term and long-term solutions, and just see if what we can do to help improve access to care, and to hopefully minimize some of the costs the costs of that are increasing each year with healthcare. So I think that is probably just a 360,000 degree view of what we're trying to do. We are also trying to have actual input from the providers to get firsthand feedback of what they perceive the problem is. So I think at our next meeting, we're meeting about every 2 weeks, we will begin to get that feedback. Any
Thank you,
questions?
Kim.
Yeah, thank you.
Yeah, any questions? Also, thank you, Kim, for setting me up for having not nearly as impressive a report back from the average weekly wage subcommittee. I think, kind of broadly speaking, the issue arose from a bill brought by AFSCME addressing concerns for the sort of lack of sufficient support for low-wage workers. So the kind of general understanding that we have, and again, very general, very subject to change at any time, is to sort of have a historical analysis of the 66 2/3 number, where that came from, how that developed, have a kind of policy discussion of why that was implemented. Is that still meeting the policy goals? Are those policy goals still relevant? So sort of have that policy discussion to get us all on the same page of, what it is that we want to accomplish and how we would like the system to work, sort of the, much more subjective analysis of that. And then say, okay, once we're sort of on the same policy page, what's the reality and how does that mesh with the policy that we're all trying to carry out? And then are there any ways that we could tweak that existing kind of factual situation to better achieve the policy, and then sort of what any of those impacts of those changes would have, so that we're making sure that fact and policy meet, which is never a messy prospect at all. So it'll be just easy breezy through the whole process. I see a couple smirks. I was hoping I'd get a few more than that, but have some good, robust stakeholder engagement already. I believe our next meeting is coming next Friday, and I want to take a moment to shout out to our friends at WCD and staff who've done an excellent job engaging with support, both in terms of developing questions and information and kind of historical analysis, but also I think if you go on the MLAC webpage and you click on towards the bottom, there's a kind of 2025 meetings, and they've sort of have separate links for the subcommittees. So everything related to the subcommittees is just found on one single page. So it's very easy for folks to get up to speed and to review everything that's been covered by the subcommittee. So I think that was a good way of doing that, and wanted to thank staff at WCD for that one. So happy to take any questions from folks on that, and otherwise also extend an invitation to join us. Sarah, I see a hand.
Thank you, Co-Chair Strickland. Can you help refresh me? Who are the co-chairs on that committee?
Myself and Stacy, who is not here today.
I thought Lauren was. I may be mistaken.
I believe there was a talk of appointing Lauren, but I was not at that meeting, and so it was decided that I was going to be the co-chair for that one, for labor. And I see a hand from Lauren.
You already covered Co-Chair Strickland. Thank you.
Great. Thank you. Other questions?
I just wonder if we need to review the minutes, though, and change that, because I believe it was.
So, Sarah, during the meeting, Lauren was assigned, but after reviewing other meeting minutes, it was actually Co-Chair Strickland that wanted to be the co-chair of that committee. So I actually talked with Co-Chair Priest, and I talked with others, and it was Co-Chair Strickland that wanted to be the co-chair of the average weekly wage subcommittee.
I think that's great. I'm just wondering procedurally, do we need to change that since it was voted upon at the last meeting?
You know what? Let me check into that, and I will get back to you and have an update at the August meeting. Does that sound fair?
Yeah, I don't mind making a motion that Scott Strickland be named the co-chair of the average weekly wage committee, if somebody would second it.
Second from Lauren.
Okay.
So we have a motion and a second. I would say in discussion, I think it's traditionally we've done it where the labor and management co-chairs sort of get with their caucuses, and the caucuses figure out who they want to appoint to represent their sides, and that makes it so that the labor folks are not appointing management folks, and the management folks aren't appointing labor folks. So I don't know that would be entirely appropriate given the history. I'm fine to take a vote to formalize that, just so we have it all guaranteed that it is going to be me. I see Kim has a hand. Did I hear someone in person also have a position?
I was just going to recommend maybe just have the minutes edited to reflect, who, is truly the co-chairs. I think that would satisfy me, just to have the minutes edited.
Well, and I know procedurally in the past, I believe, Sarah, you were on the subcommittee for continuation of care, I think was the title of it. And I think there was one other one that we'd had in the past as well. And typically there was like a formation of the subcommittee, and then the co-chairs would decide and appoint who would co-chair that. So again, there wasn't sort of a formal appointment of co-chairs that was handled within the caucuses, but again. Margaret?
I suggest we just let the minutes of this meeting clarify what, they will detail this discussion, and that the minutes of this meeting will clarify that you are the co-chair of that committee.
We can add, I just asked Teresa, I think maybe the charter says, I remember when we redid everything from MLAC, we talked about how to create subcommittees. Teresa's checking to see if how the charter, MLAC charter talks about the co-chairs of that. This might already be addressed. If not, maybe it's something to add.
So
maybe give us a minute.
5-minute recess?
Well, you keep talking, and we'll come back to this.
Okay,
Sorry,
so
Strickland.
we'll keep.
I wasn't trying to open a can of worms. I just procedurally wanted to make sure it was accurate. I have no issue with you co-chairing the committee. Clearly, you can take it, but I just wanted procedurally it to be noted that we had appointed Lauren in the last meeting.
Yes, you're absolutely right.
I appreciate that, but I do think that is a good. It's always good to be specific on procedure when performing things like this. So,
did have a motion on the table. Do you want to remove that motion and just let the minutes reflect that Scott is the co-chair of average weekly wage?
I would withdraw my motion. I don't mind.
Why don't we wait until Director Stolfi gives us how to appoint the sub?
So I can add that the MLAC charter talks about subcommittees and some committees creation. Subcommittees may be appointed by the co-chairs, and then the co-chairs are responsible for designating an equal number of members, giving the subcommittee a charge, a deadline, allowing other people. Unfortunately, it doesn't speak to how subcommittee co-chairs are appointed. I would say the charter gives the co-chairs pretty broad encompassing power over the creation and everything that has to do with a subcommittee. So I would say, unless you want to, you could always look at amending the charter in the future. Not a terrible idea. But I would say as long as the co-chairs agree on who the co-chairs of the subcommittee are, that's probably all you need.
Okay.
So thank you for that. Understood. And that I think jibes with my understanding of how it works. So just for clarity's sake, maybe the motion could be amended, and if my parliamentary understanding is accurate, which it likely is not, the person who seconded would have to withdraw, and then the person who made the motion would withdraw, and then we could entertain maybe a motion to devolve the authority to appoint and change co-chairs of the subcommittees to the co-chairs, potentially.
Why don't we just withdraw the motion and make it known in the minutes that Scott's chairing the subcommittee?
Lauren, that's you, buddy.
I am happy to withdraw a second and move us along in lieu of this very fruitful argument.
Not an argument, discussion. Patrick, would you like to?
Yes, I repeat that I am happy to withdraw my motion.
Okay. Okay, motion is withdrawn, I think, effectively.
All right.
Yeah.
And thank you, Sarah. I think, again, it can be silly, but procedure matters, and it's important that we follow that process, so that we have Robert's rules for a reason. And I do know that there was a discussion as to what procedural rules and parliamentary rules would apply to MLAC. I think that's also discussed in the charter, because it's my understanding that the legislature uses something different. So Teresa's probably there shaking her head and laughing at all of this because I know we went through that with, I believe, Kara and Teresa with the sort of, MLAC 2.0 as we call it. So, okay. Any other questions about average weekly wage subcommittee? So upcoming meetings, July 2025, I have it marked as no meeting. And then August 7th in person, is that correct? That's at least what's reflected in the minutes.
That is
I mean,
not correct.
sorry, the agenda.
Yeah, it will be virtual. August 7th will be virtual. I will send out updates to the calendar. And so no meeting in July. We will be virtual August 7th.
May I note that the end of August would definitely work better for me if you're considering changing that.
Okay. Thank you, Sarah. Would just very, very informally, would the end of August work for other folks as well?
I concur.
Especially virtually?
Yeah. Patrick, it would work better in later August as well. Plus, I want Sarah there. She's our superstar management caucus member, so.
That would be great. I do appreciate Sarah's perspective and input. Okay, anything else? I also would like to take a moment to thank Director Stolfi for his tireless work and access and engagement on this. It has been a true pleasure to work with / for him on MLAC. And his guidance and his support for his staff and everything has been invaluable in my participation here. So I want to thank him again for that and congratulate him for what I'm sure will be a very successful run in his next position. So thank you for all your help. I appreciate that. And thank you to everyone. That's all that we have on the agenda. So happy to end a little early here and give some folks back their time.
Thank you very much.
Thanks.
Everyone. All right. See you next time.
Bye-bye.